Hi there, this is Kristina Sawtelle. I have done everything in my power to try to get my camera to work. I don't know what else to do, so I'm going to take a picture of myself with my ID and upload that as well, and hopefully, that works. But beginning this, I'm going to do my assessment on Tina. I am going to start with obtaining a set of vitals. These are her vitals. Her vitals look great. And then I'm going to assess her orientation. This is a huge thing because sometimes you can have a full-blown conversation with someone and they could have no idea. They could seem like they know what's going on, but they really could have no idea. Ask her, what building are you in now? Perfect. And then what is the date and year? Perfect. So she is alert and oriented, which is wonderful. I also want to add in there, so for my physical assessment, I didn't add a lot of the musculoskeletal movements and range of motion because I feel that looking at her and watching her walk and move everything as I have her adjust, for the assessment, that is proving that she can move everything and that she has full range of motion in all of these areas. If for some reason she were to come in complaining of a specific area that's bothering her, I would further investigate that area. But as far as going through each individual body part, I don't believe that that's necessary. I am doing a basic inspection as well of just like her skin and her musculoskeletal, because as I also feel that inspecting each portion of her body is something that I'm going to do as I go through her assessment. So I'll just do like a quick musculoskeletal and skin inspection area. Everything looks good. There's nothing that's concerning. And then I will go back and then I will start the exam starting with her head and neck. I'm going to start by inspecting her head. This will also inspect her hair. If there was something that was possibly concerning, I would palpate, but there really is not. I'm going to now inspect her eyes. This is important to make sure that her sclera is nice and white. There's no yellow, no redness, indicating maybe something else is going on with her. Inspect her mouth and her throat. Going to depress her tongue. Make sure everything's pink and moist. Her tonsils aren't swollen. And then once I move her tongue all around to evaluate her mouth, I'm going to test her gag reflex. There, perfect. Going to inspect her eyelids. So it's just like another portion, making sure that they're nice and pink with no extra redness, or any, excessively dry, anything like that. All right, so I'm going to palpate her carotids. This is a part of the cardiovascular assessment, but I think that it's nice to go, solely head to toe. So this is nice and expected at a 2+ with no thrill on her right. And it is also 2+ with no thrill on her left. I'm going to palpate her lymph nodes. I think that this is really important because palpable lymph nodes can indicate further issues, especially with the axillary. That's like a huge sign of breast cancer, or that something else is going on with one's breasts, and they've like extended into the lymph nodes. So it can also indicate like an illness, like if you're sick, you have swollen lymph nodes, you can typically palpate them. So this is a pretty important step. All right, moving on. So we're going to do the axillary lymph nodes. There's nothing palpable, which is wonderful. And then I'm I'm going to use a pen light to check her pupils, make sure they're equal, round, and reactive. I definitely think that this is very important because in someone who's like a neuro patient or who had a traumatic brain injury, the pupil size and reaction is a huge indication for maybe something that's going on further in their head, to indicate, possible stat head CT or something like that. Finally, we're going to listen to her carotids, make sure there's no bruit. No bruit on her right, and no bruit on her left. Perfect. So we are going to move on to her anterior chest. I'm going to just do a quick inspection, although I feel like I'm doing this every part. Going to use the spirometer. This is a good indication of how, what am I looking for? What words am I? The capacity, like her lung volumes and everything like that. So once you do the math of this, we're at the appropriate percentage. I'm going to listen to her anterior chest. Her lungs are nice and clear. Now I'm going to percuss. You always want to make sure you do all areas because sometimes you can do maybe one side and be like, okay, the other side is, the same, but that could possibly not be true. So making sure you do all lobes and all quadrants and whatever you're assessing is important to make sure it's all normal. And then we're going to listen to her cardiac points. I'm going to start with aortic, flip it over to the diaphragm, making sure there's no murmurs or clicks or rubs. Erb's point, tricuspid, and mitral. Also just making sure the S1 and S2 are heard with no additional sounds. And then we're going to move on to her abdomen. So this inspection route, or this assessment route, is different because palpating and percussing the abdomen prior to listening to it can alter bowel sounds. So after inspecting her belly, making sure it's round, we're going to actually listen to her abdomen. You always want to start in the right lower quad and listen to her bowel sounds. They are definitely normal in all quadrants, which is wonderful. And then I'm going to listen to her abdominal arteries. So starting with the aorta. And then we're going to do the right renal, the left renal, right iliac, left iliac, and then right femoral and left femoral. And all of them are no bruit, which is perfect. So now I'm going to percuss the abdomen. Again, all four quads going to start in the right lower. Everything is presenting as tympanic so far. And then I'm going to percuss her spleen. And there's no dullness. Perfect. I'm going to percuss the liver span, making sure that this is a normal range. So 7 centimeters is great. That's a normal range. And then I'm going to do a light palpation. Again, light palpation is really just determining if there's any questionable masses and making sure the belly's nice and soft. No distension, no hardness, indicating like a bowel obstruction or anything like that. So everything is nice and soft. And then I am going to move on and do a deep palpation. Again, starting in the right lower quad. This is when someone will probably tell you whether they're having significant pain, And again, it's important to do all 4 quads because there is a different organ in each area. So you could be, there could be a problem with an organ that's in the left upper, and if you skip that area, then you could miss that. So no masses are all noted, which is perfect. And then I'm just going to lastly palpate her organs. So we're going to do the right kidney, which is not palpable. I'm going to do the left kidney, also not palpable, and then going to do the liver and the spleen. The liver is palpable 1 centimeter below the right costal margin, but the spleen is not palpable. All right, so we are going to move on from the abdomen and do her upper extremities. Again, this is where I don't believe that look, I mean, she's moving right now, so we can see that everything has full range of motion, as expected. Fingernails, no ridges or abnormalities. Doing capillary refill in the upper and lower extremities is important for cardiac assessment. I won't do every single finger, but I will do one on each hand. And it is less than 3 seconds, which is normal. And then I'm going to test her deep tendon reflexes in her uppers. So starting with her right brachioradial. Working our way up. So far, 2+, which is as expected. If there was something that wasn't expected or like it didn't meet criteria, we would further look into it. But so far, everything seems normal. Perfect. And then last one. Okay, going back. And then the last portion is her lower extremities. I'm going to inspect the toenails again. Now, she does have a history of diabetes, so her toes would obviously be our concern. I'm going to inspect her legs for edema. That's a cardiac thing. There is no present edema, which is wonderful. I'm going to palpate her lower pulses. How I do it typically is I start with the dorsalis pedis. If for some reason this is not palpable, then I work my way up. I'll obviously get a Doppler and move forward with that, but I would work my way up and figure out where the pulses stop, and go from there as far as looking into it further. So her dorsalis pedis are all palpable, which means that her femoral and her popliteal are all palpable as well. But assess the capillary refill in her toes. Again, I won't do every single toe, but I will do the big toe on both. And is less than 3 seconds, which is great. And then lastly, going to test the deep tendon reflexes in her lowers. Again, she's moving all extremities, she's moving her legs, she's moving her feet all around, so I do know that she has full range of motion in all of these limbs, and I don't feel that I need to go through each one. Also, although I did inspect, I can clearly see her whole body at this current moment, and there's nothing of concern. So typically I probably wouldn't do a full inspection of each individual area. All of her deep tendon reflexes in her lowers are at a 2+, which is expected, which is wonderful. So at this point, all the essentials for each category have been covered, and I would send Tina on her way to her new job with her past physical assessment. I'd get her sitting back up, make sure she knows that everything is okay, and I would go from there. But thank you for looking at my assessment, and I believe that I personally covered all areas that I find important for myself and what I would do in my personal situation. Thank you.